Welcome to the Connecticut Health Policy Project's video primers on health advocacy tools. This third video in the series is about Connecticut's state budget process. Healthcare is expensive and it's big business. Usually healthcare advocacy involves money. Often it is the center of the issue. One of the most common advocacy mistakes is getting a bill passed but no funding in the budget to support the program, and the law never gets implemented. This year, in 2013, Connecticut's total state budget has grown to over $20 billion, growing 4 to 5% each year. The budget just passed by the General Assembly, awaiting the governor's signature, addresses a projected $2.5 billion deficit over the next 2 years. It is much harder for advocates to find money for new programs or solutions when the state is facing a deficit. Health is a large and growing part of Connecticut's budget, as it is for most states. This makes it even more important to be responsible about spending. The Connecticut Health Policy Project has collected 31 ways to save money in Connecticut's healthcare budget without sacrificing, and in many cases improving, the quality of care. All these ideas are being used successfully in other states or other systems. The governor has the greatest role in developing Connecticut's budget. The Office of Policy and Management, or OPM, is his budget office. State agencies each have offices that track their spending and make estimates about future needs and develop policy options. In the legislative branch, the Appropriations Committee and its subcommittees develop the spending side of the budget. The Finance, Revenue, and Bonding Committee develops the tax and revenue side. The state comptroller, an elected position, keeps the official state books. He's the final arbiter of whether the state has a deficit or a surplus. The office also administers the State Employee Health Plan, covering 200,000 workers, retirees, and dependents. The treasurer, also elected, manages state accounts, borrowing, and investments. The auditors, one Democrat and one Republican, oversee a large office that monitors fiscal accounting in all agencies to guard against improper use of funds. The Healthcare Cost Containment Committee is a joint labor and management committee that negotiates health benefits and sets policies for all state employees. State budget staff, particularly the Office of Policy and Management, are very wary of new spending and claims by advocates and others that investments will save money in the long run. It's important to be able to back it up when making this claim. The budget process is essentially ongoing throughout the year. Agencies are constantly tracking revenues, spending, and economic trends. Agencies give their options to the governor in the fall. He delivers his budget proposal to the legislature in February. There are public hearings on the budget soon after. The budget goes to appropriations subcommittees, then back to the full committee. Advocates can track the various versions of the budget by listening at committee and subcommittee meetings. Members usually signal their intentions in those discussions. The committee passes the budget out in April, generally. The appropriations and finance committees have to reconcile their versions to be sure the state will have enough revenue to cover expenses. Adjustments and negotiations are going on throughout the process with the governor, agencies, and interest groups. The budget, split into several bills, one with the numbers and others called implementers with the context that describes any changes in policy, goes through the regular process, passing both houses and most often being signed by the governor in May or June. The new budget year starts July 1st and the process starts all over again. Technically, Connecticut passes a biennial budget in odd-numbered years, but they make so many changes to it in the even years that it's essentially a new budget every year. Connecticut has a constitutional spending cap on the total state budget, passed as part of the deal to institute our income tax in 1992. Policymakers cannot raise spending by more than the rise in personal income in the state or the inflation rate. The state often exceeds the cap by declaring an emergency, but this requires the votes of a supermajority of members in both houses. Several types of spending are excluded. This year, for the first time, policymakers decided to exclude federal Medicaid reimbursements from the cap. This was to ensure that Connecticut could take advantage of significant increases in federal funding to states under the Affordable Care Act. An important source for budget documents and information is Open Connecticut. Operated by the State Comptroller's Office, the website collects a huge number of relevant records with plain language explanations of concepts and processes. There are a number of concrete tools for budget advocacy in our CT Health Policy Project Advocacy Toolbox.